likely be experiencing a variety of different things, from elation and excitement to overwhelmed frustration. That's typical. Now is the time to make sure that you're not letting up. Okay, so be consistent now and fight through any of the overwhelmness that you're experiencing. I posted a link. It's underneath the midterm. Tomorrow's midterm. You certainly don't have to do it. It's just a guy talking about consistency. It's a short little YouTube thing. And the link is only good for about 48 hours. He takes it off. So if you want to watch it, it's really kind of a cool...
Who takes it off?
He does. He only posts it for a short... He posts these little things for a short period of time, and I thought this one was pertinent.
Okay.
And it came through this morning, so it's only going to be there for about 48 hours. So at some point in time, take a look at it. It's about 9 minutes, and it has pertinent words of encouragement for the area that you're in right now. So I would encourage you to take a look at that at some point in time over the next day. I just want to find out if you have any questions on the midterm, and I will take questions and answer those for a couple of minutes before we turn it over to Chris. Many of you have gotten answers over the course of the last few days, but if there's one that's blaring, now's the time.
I know we've talked about in class when we're doing skills, just going through and doing the skill. Tomorrow for the midterm, should we be verbalizing?
Okay, let me clarify what I've been talking about and trying to get people to promote and understand. I want to change in the way that you look at approaching your skill, right? Mons and Blake are my biggest guinea pigs recently on this. Right? That was difficult. I want you to have the right mindset for learning the skills properly. And so what I'm wanting you to get away from, and what I would prefer that you do, what I want you to get away from is talking to an evaluator. Chris is my evaluator, and I'm doing skills. I don't want to sit there and say, I would open the airway. I would set my SpO2. I would be looking for the vocal cords. I want you to get away from that communication. He's not going to be there. He's not going to be there for you. He's a leader. He's not going to be there for you.
Because the only question I would come back over the top of him, well, how would you do that?
Right? I want you
Okay,
to,
how you would.
instead, I want you to do the skill. And any communication you have would be communication that you would be having with your partners that are there, right? So some things don't need to be said at all. For example, you don't have to say BSI if you're wearing BSI, right? When you're looking at the chords and passing the tube, it would be more appropriate to say, all right, I see the chords, I'm passing the tube. Because that's information that your partners would value to know as they're getting ready to help you with the next step, like getting ready to put the BVM or something like that. Does that make sense?
Yeah.
So there's a difference between you listing things that you're doing and helping yourself stay on track and narrate the activities that you're doing and talking to an evaluator. And I want you to get away from talking to the evaluator. I want you to pretend they're not in the room. You have you, the patient, and a partner. That's who's in the room. Does that make sense?
Yeah.
So when we were talking about it, when we go through our midterm, is it something where if you have a question, you'll ask us as we're doing it, or we just...
Yeah, so if there's something that...
We're not
that
doing
needs-
it, but like you said, you don't want us to...
Yeah, if
like,
there's something
say
that needs to be clarified, we'll get clarification.
Okay.
If there's something that you need to be saying because it's what you would be saying in that situation anyway, then you say it. What I don't want you to do is ask questions of your evaluator. I want you to consider them not being in the room.
Unless they ask you...
Unless they directly engage you for some reason. I want you to not even think about them in the room.
We try not to because we don't want to prompt you to change, alter what you do.
Just do what you're gonna do. Things like, you don't need an evaluator to tell you what the SpO2 is, right? You can just, you know that you're about ready to do intubation. You know you're supposed to provide oxygen. You know the SpO2 is gonna be low, right? Just make something up. You can just say, all right, I've got an SpO2 of 88. If it needs to be different, we'll change it, right? If you're doing assessments, I want you to take those pulses. Don't grab someone's arm. What do I have? Right? Take their pulse. All right, I have a pulse of 78. It's actually 120. Done. We just corrected it. And you can move on. But you need to get into the habit of doing those skills and interacting with a partner, not interacting with this third party that's sitting over here and relying on them to give you information. Does that make sense? The difference there? It's more of a mindset than anything else that I'm wanting to change.
So even if we're being tested and it's a mannequin and we manually take the blood pressure, you want us to
Yes.
come up with a number, and then if they don't.
Yeah, you know what it's gonna be, right? You're not gonna take blood pressure on a mannequin. But at the same time, you know what things should be. So start with saying this is what it is. We'll correct that if necessary. Right? I'm not saying that we don't want you to talk while you're doing your skills. I want your talking to be related to your own internal drive and your partners, and not communicating with an evaluator. Make sense?
Dustin and I started practicing where I would direct Dustin. Like, Dustin, set up my SPO2, tell me what you got.
Well, SPO2 set up, it's 98.
What's-
Closed loop
Coordinated with
communication.
us.
Yeah.
Dustin, get my oxygen set up at 15.
Oxygen set up at 15.
All right. Take over bagging while I get ready to innovate.
Bagging.
Just
Brooke, you have a question?
At the top of a lot of the skill sheets, it says checks equipment. Is that something that that's just a reminder for ourselves, or are we saying,
Well, you should be checking the equipment.
yeah, so we don't have to verbalize that?
There's not a lot to verbalize there, although if there's something pertinent that your team needs to know, same thing. It's a model of getting your equipment out and making sure that it's set. It's your time.
Before the assessment starts, before the skill starts.
It is part of the skill as you're making sure that you're
Mhm.
setting things up and getting ready. Okay, questions on the midterm? All your questions have been answered over the course of time.
Are we gonna have proctors come in just like the
No questions
basic?
on the midterm. Just making sure.
The
I'm sorry.
previous midterm, the written midterm.
That midterm is the one I'm talking about right now. The one you just took. Everybody good? Fantastic. Good question. Okay.
Nope.
Mark, go for it. Now, what's your question?
Is our midterm tomorrow gonna be set up like the basic midterm?
Similar, yes. Yeah. Others?
The proctors that are coming in to help with the midterm tomorrow, are they gonna have that same understanding that,
Of course.
theoretically?
And we're taking the midterm during our lab times?
Yep. That is correct.
Is there a set number of skills, like there's 7 skills we're testing on, or 6?
25.
No.
25.
This is all the basic ones.
This is all the basics,
This is
all
eight-year-old.
the,
It's all listed what the possibilities are. On the- yeah. Others? Your turn.
I'm taking the midterm right now. Get back to me in about 3 hours.
We only had an
Okay,
hour
I
and
have
20
two
minutes, so.
questions.
You bet.
Okay, so for our tests being cumulative,
Written exam stuff.
yes,
Go on.
those are cumulative, so,
Yes.
is the best way to prep for that reviewing the quiz or reviewing those specific set of questions?
The questions will never be the same. Reviewing that same set would only benefit you by
In
giving you
terms of content?
yeah, would be giving you and that would be the way, is if you struggled on a particular set of questions on that, that would be the content to go back and look
Got it.
at. It's not always evenly cumulative, it's not always weighted at what we just did, and it's not always weighted towards what we previously did.
Okay.
I try to be relatively even on that
Cool.
for each of the exams, and I try to keep the number of questions of about 35 to 55, somewhere in there. I'm not trying to give you 120 questions to kick your ass on.
And then, are we gonna be talking at all about Dr. Death?
Yeah, so as soon as we get through we'll keep putting the podcast on for those of you that are listening until we get it done, and then we'll have a discussion on it. You guys been listening to it? Yes.
Yeah.
I skipped forward and looked at what happened to
It's
him.
just a little scary.
Little bit.
Yeah.
Just a little.
And the red flags that pop up as you go, like, you guys didn't pick up on that until that late?
Yeah.
Yeah.
But it puts our previous discussion, 2 discussions that we had over there, right, in perspective. Because those are pretty light and meaningless compared to the one you're listening to right now, but still.
What year did this happen in?
2006, yeah, was it 12?
Yeah.
But he just got
Yeah, I
convicted
think
in
he's just now
16.
getting through it.
Bro,
Okay, so
Thanks for rooting
Very
it
Yeah.
in.
I went to Wikipedia and looked up the ending.
yeah, it just went through, so, oh, wow.
Spoiler
So what
alert.
happened?
And the episodes are posted are still getting posted.
Okay, other questions? Now it is officially up to you. I know, but I told you it might be yours.
I wasn't totally prepared, I only made it to question 29.
So everybody just needs to stare at Chris, and that's all we're gonna do for the next hour.
Good, Mark, good.
Oh,
You
you know
haven't
what,
even
wait,
seen it yet. You haven't
there's
even
one
seen
more
it yet.
question. You're right. The quiz that you're gonna do on the medication thing on Thursday, just format, so you understand what the format's gonna be. It'll be basically, little mini scenario things that then ask questions about that. So it might be something like, you have a patient that is experiencing this kind of pain, what medication might you give them from the list of things that you've done so far? It might be, this is happening, what's the mechanism of action of this drug that you're gonna provide? And I wouldn't necessarily list the drug, it might be, you have to determine what drug you would give, and then what the mechanism, but the question's about the mechanism of action of what drug you would give, right?
So we don't have a word bank.
No.
Okay, that's kind of what I thought.
Yeah.
I was just making sure.
I will not ask you any dose-specific questions on any drugs where dose is still questionable. For example, there is absolutely 0 question on the face of this planet on the dose of epi. If you're licensed to use epi, the dose is set, right? Same with nitro, same with aspirin. On some of these other drugs that we haven't, they're not in the mix of what we're doing yet, where you're just supposed to be collecting the information, that we haven't helped you on the dosaging yet, I will not ask you dose-specific questions on those. Or I might, in the question, provide the dose already, and then go from there. Yeah.
So the way you're making this sound is we'll have to spell the drug. Are you gonna go total?
Spell the drug, I didn't say anything about spelling the drug.
Well, I mean, you said we don't have a word bank though.
It's multiple choice.
Is it multiple choice?
It's not necessarily multiple choice. And
My only question is, like, some of.
does spelling count, is that what you're asking?
Yeah,
Oh,
if you're like one letter off.
Spelling always counts in everything.
Heck, how bad does it look if you put it on a chart that goes to court
No.
and you can't even spell the drug that you gave?
But if you're spending time practicing, I don't know that I would spend the time on spelling as much as I would spend the time on mechanisms, actions, and modifications. That being said, if you spell the drug atrociously, I may not give you full credit either. Right? If there's a,
Beautiful.
That's not even spelling.
Right? That's what you do, right? Sucks, holy.
Yeah.
Which
So
one?
then you're not signing your signature.
No more questions.
Does that mean RSI drugs are gonna be on there, or just basic stuff, you think, since we already talked about it?
these drugs,
Dosage wise, I'm sorry.
these drugs.
License to give.
If we have discussed and clarified dosaging on a drug, then that dosage absolutely could be discussed here. If I have not clarified dosage, because we haven't got to that particular topic where that drug has
Gotcha.
been a part of
Should
our
we
system,
trust
then
Chris and his dosages that he gave us? I don't know about that.
I'm not talking to Chris, but
We don't quit, or we don't talk, I just quit.
I just understand his resignation, so.
I didn't hit the, RSI dose or.
Perfect.
Don't
You're that perfect.
Don't put.
What'd he say?
I told him I just gave you guys the dosing for Lane County Protocol for RSI. He said, perfect.
Yeah, that's what I was asking. I was like, is that gonna know this? Yeah.
So,
But
no,
only, it was only for,
I should have asked the question.
no,
All of it.
was perfect.
My notes that I put on.
You should have seen my board. It was,
great.
Beautiful.
It was totally organized and,
I've got a video of it.
I was gonna say.
I was like, I got a screenshot rather than.
Completely made sense.
It's a little,
Huh?
Enjoy.
there's a lot of different.
Oh, his RSI talk.
Discussion last week.
Alright, we got a piece of paper? Piece of paper, grab a piece of paper and pencil.